Hi, I'm Tina Porter. I'm really happy to be here today to go over the 4-year efficacy and safety data of the continuous Secukinumab from the Sunshine and Sunrise trials, which are the core and extension trials for moderate to severe HS. This was actually just presented at our biggest North American research conference, which we call the Symposium for Hidradenitis Suppurativa Advances, or SHSA. And this data is very exciting because this is our, I would say, most recent in the second wave of HS studies for IL-17 to have data out to 4 years or 204 weeks. So it's really, I think, good for patients to understand and prescribers and dermatologists too, how long this drug really has an effect for these patients. Just as a brief background, the data from the Sunshine and Sunrise core trials was presented before, but essentially patients were on every 2 or every 4-week dosing of Secukinumab, 300 milligrams, which is the same dosing that we use for psoriasis. And then at week 52, patients were assessed to be either high score responders or non-responders. And those that were non-responders actually remained on Secukinumab. So they either stayed on the every 2-week dosing if they were on that before, or they got up-titrated from every 4 weeks to every 2-week dosing if they were a non-responder, meaning they did not meet high score 50 at week 52. And then the other patients that were high score responders were actually re-randomized to either the same dose of Secukinumab they were on or on placebo, because this was a trial out to week 104 that was looking at randomized withdrawal, which we don't really do for HS trials anymore. But I bring this up because the data that I'll be going over today are just for patients who received continuous Secukinumab treatment for all 204 weeks, which means that they were never randomized to placebo in the core trial, or they were never re-randomized to placebo again in the extension trial. But patients could be on every 2-week or every 4-week dosing, depending on what their response was during this extension. So I hope that gives some background to people just so they understand. But there were about 172 patients that we were looking at for the continuous Secukinumab in terms of efficacy from the data, but the data we have for safety actually includes all patients, both responders and non-responders, which is about almost 400 patients total out to 204 weeks. And the difference between the responder and non-responder groups in terms of their baseline characteristics were almost none, so they're pretty similar. But what we saw essentially is that of patients who are high score responders, meaning they hit high score 50 at week 52, over 80% of them, so the trial actually found 83.2% at week 204, maintained that high score 50 response or achieved a high score 50 response at week 204. So a very high proportion of patients. And I think this is exciting because unlike TNF-alpha inhibitors, where we see a large proportion of patients whose response over time, we really don't see that in trials of IL-17 inhibitors for HS. And then one of the other very interesting data that they showed was the greater depth of response. So high score 50 has always been our standard, but now we really care more, I think, about patients who reach high score 75, high score 90, or high score 100, because those patients have much, I think, more impacts on quality of life. Like when I think of patients that I treat in my practice, what they're really hoping to achieve is a 75% response or more. And so for reference, at week 52, about of the people who are high score responders, so meaning they had already met high score 50, there were about 2/3 of those patients who also were high score 75, just under half, about 47% of patients who met a high score 90 threshold at week 52, and then about a third, 33%, who were high score 100. And when we looked at the 204 data, it was actually still very high. As I just mentioned, 83% of patients were high score 50, but 75% were high score 75, 50% were high score 90, and 40% were high score 100. So we saw very great depths of response out to the 4-year mark as well. And then in a different sort of analysis that we haven't done so far, where some of our long-term extension patients are, there were patients who achieved high score 50 at week 52, but they did not achieve a greater depth of response, such as high score 75, high score 90, or 100. But Novartis actually looked at these patients who achieved high score 50 and then tried to quantify the number of patients who actually had an improved response, meaning they met a higher threshold of high score out at week 204. And of these patients who achieved high score 50 at week 52, but not 75 at week 52, 72% of them actually achieved high score 75 at week 204. 46% achieved high score 90, and 35% achieved high score 100. So there were patients who had improved responses over time too, out to the 4-year mark that didn't achieve them at year 1. So this was really exciting. And the draining tunnel data too also showed very stable numbers out to the 4-year mark. There was really, it just plateaued. So patients had improved, the mean draining tunnel counts at baseline for the studies were 2.3, and at week 52 for all patients that were high score responders was about 0.8, and the same out to week 204. And they also showed some long-term safety data, and it really showed that secukinumab safety profile in HS, even at this higher dosing, was very similar to the other indications for secukinumab. So we didn't see any new safety signals. And there were still relatively low rates of fungal infection and these hypersensitivity reactions and eczematous dermatitis that we've started to sort of associate with IL-17 inhibitors in HS. But it's all very reassuring, I think, from a data perspective, and it's very encouraging too, knowing that out to 4 years, patients continue to maintain and even potentially improve their response over time. And as I mentioned before, this can have a really, really great impact on patients. We have many more treatment options now than we did 7 or 8 years ago when I started treating HS. And I think patients, I was noting even on Monday, I saw quite a few new patients, and we spend a lot of time in the room with patients, I think, who are crying and having a very difficult time managing their disease. And to be able to offer them treatments and to tell them about this data, I think really impacts their ability to make treatment decisions, because the population overall, I think, is a little bit more biologic hesitant than we see for other disease states. And this was actually shown in a real world study that Novartis also did and published at SHSA, that probably the biggest barrier right now to getting a patient on a biologic is a patient's own concern about taking the biologic. And having this very reassuring safety and efficacy data, I think, will really help us be able to impact more patients' lives very positively by getting them to take some of these medications. And then just overall, I would say I went to this HSSA conference, which I chaired, and the enthusiasm and the energy around HS is just totally unmatched for any other disease state right now. It's a very unique conference where we bring together leading researchers, clinicians, but also a lot of patients. And it's probably the most collegial conference you'll ever attend. But I always joke that HS is probably finally getting its day in the spotlight. And one of our patient-facing groups, HS Connect, actually just had a fashion show essentially in Times Square where they proudly marched around in their underwear and showed off their HS scars and really made sure that people know what this disease is and know that you do not need to be embarrassed or ashamed about it anymore. And I also, just as my last thought, I had given a talk right before SHSA at the American Dermatologic Association conference, but I noted that on average, patients with HS face a diagnostic delay of about somewhere between 5 to 10 years, which is hopefully declining. But probably the most famous person to ever have HS is Karl Marx. And there was a British dermatologist who went back and studied his many volumes of writings, and in 2007 noted that he probably was misdiagnosed as having carbuncles and furuncles and really had HS, and it had a huge impact on his psychologic just like issues and quality of life and his ability to write. And I joke that he probably has the longest diagnostic delay of any patient, over 150 years. And, you know, we are doing so much better, I think, with this field now, and we're so fortunate to have so many research innovations and so many partners, industry sponsors, patients, clinicians who are really focused now on making these patients' lives that much better.